Hello, everyone, and welcome to day 3. This is our live Q&A session of Pet Summit's Pet Pain Relief, and this is our rerun program. So glad all of you are here tonight or in the morning, wherever it is that you're located on which side of the hemisphere. Um, First, want to do a thank you to our sponsors. So Turmeric Life. I encourage you to visit that website, learn about all the different products they have and the science that Dr. English has put into turmeric. And being a part of today's program, you got to hear him as well. And then also Chi Dog. So this is a gently cooked, human grade, and it's food that's based on traditional Chinese medicine. So please check out their website and see if that's something that would work for your pooches out there. I also want to let you know, yesterday we had a request to post my dental paste, and I sent that recipe over, and everybody that is signed up here will actually get an email with that. So you'll be receiving that directly. So I wanted to let you know I followed up on that. And let's see what we're going to talk about today. So we had our programs. We had Angela Ardolino, which she talked about mushrooms. She's done a lot of studies recently with that, and then their CBD products. Dr. Judy Morgan with PEA and how that can be used for inflammation, pain, and seizures in some dogs. And then also Dr. D. Blanco with homeopathy. And then Dr. English talking about reducing inflammation with the use of turmeric. So hopefully you were able to watch all of those, whether it was your first time through or a repeat. There's always something that we can gain from watching and listening to somebody else at different times. So I'd like to open it up to any questions anybody has about that or something from the past 2 days. If that's something's come up in your universe and you want to ask a question regarding any of those other topics, then I encourage that as well. Also, to give you a little bit of a heads up, we do have the Life Extend Method program, which is going to be available again. And this is time that you'll spend just with me. There are programs that are expanded, more information than what you get in these. In addition to more about the pain, there's also a program that I did specifically about arthritis in cats. And there's another one on there about cancer. There's some programs that you haven't seen in other places. And I think it would be very valuable if you're interested in learning a little bit more about how to help your dogs and cats live a longer, healthier, happier life. Then that's the way to go. So that program also will have, at the end, we'll have a live Q&A session. So you get to have more time to spend watching those. You don't have to do them so many days in a row. And then at a given timeline, then we have a little evening chit chat like we're doing tonight. Or again, morning, depending on where you're at. So yeah, there's the link where you can go see about that and sign up. All righty, so we're ready to rock and roll here. Let's get some questions coming my way. Oh, thank you very much. Yeah, so you're a pet mom. That's very good. And thank you for your compliment. I appreciate that very much. I definitely enjoy doing them. All right. So, okay. So here we have somebody just listened to Dr. Judy talk about the PIA. Can you recommend a powdered form of this supplement available here in the UK? Well, actually, I do not know about a powder supplement. I don't know. You can check on Dr. Judy's site. If they don't ship to the UK, then I would suggest that you email them and ask them for what's their recommended company for a good product there in the UK. I'm sure if you Google it, you can find all kinds of things out there, but I know you want to get one that's a quality product. So I would email her website and ask them, and they'll be able to help you with that one because I don't really know one for sure. All right, here's a dog who doesn't like the mushroom powder. It's supposed to be a food topper. Yeah, something that you would add on or mix in. She hates it. Any suggestions? Well, so there are certainly mushroom products that you can get in tablet form. And again, you're going to need to make sure that it's a high quality so that you're getting the right part and the right activity of the mushrooms or the right type. The company that I use as a tablet form is MediHerb. There are also some companies out there that have like drops and different things too. So I'm not sure on the drop end, but I do know there are some out there. The mushroom products I tend to use are MediHerbs, if not Angela's. So those would be my suggestions on that. Another thing could be is that if you take the powder and mix it in something else, maybe that would alter the flavor, not just the food, but like maybe a broth or tuna juice or something else like that. And maybe it's not the product that your dog needs. Maybe they don't need mushroom and that's why they don't really like it. Thank you for that. You can drop your questions. Oh, okay. So yeah. So yeah, we do have the section here where anybody that has questions certainly can load them up into the comment section, and then I can see them there as well. Yeah, if you haven't, like you might be joining in tonight and you haven't been able to watch all of them. If you're trying to pick and choose, I definitely would recommend going to Dee's programs, her homeopathy. She has it outlined in a really logical format, and the information there is pretty amazing. All the different ways that you can use homeopathy and the products that you can access to help in the areas of pain and inflammation. So and also that I find in the homeopathic products is most animals don't detest those. And because they're a lot of times drops, sometimes they're the little beads, but a lot of them will come in a liquid form. So they're easier to administer and actually better absorbed. Okay, so Maria has a senior dog with osteoarthritis, wondering where I can source some of the natural oils such as turmeric, which was mentioned in multiple presentations. You're in Canada. So you're talking about essential oils as far as the natural oils. So you could Google up essential oils and find out like which companies would ship to Canada, or they might already have outlets in Canada. So doTERRA would be one to check out. Young Living would be another. If you're talking about essential oils of the turmeric, then I would start with those and then go from there. Okay, so this one we had yesterday. I don't see anything new in there about the golden retriever itching. Certainly from today, where we were talking about inflammation, you can go then and look at some of those homeopathic options there. We talked about the other items that I didn't talk about the PIA with that dog, but yeah, there might be some things in the homeopathic and Dr. D's program that you could also pull up to help the dog. That was the one where we were going to make sure first that it wasn't sarcoptic mites. All righty. I guess while oh, here we go. Okay, that's fine. Dog was recently diagnosed with Cushing's. Okay. Okay, so the test was positive, but she's not dramatic. Any suggestions? Okay. Any herbs to lower cholesterol? Okay. So yeah, certainly your point is very good here, is that um, anytime the adrenal glands are working high, the liver has the potential to be impacted. So that's part of where the we have to look at supporting the liver also. There are other areas there. So if we're looking at supporting the liver, you can use the dandelion root to help support the liver. There is the milk thistle. There's a lot of different liver. Burdock sometimes can help the liver. So there's that part of it, to just not isolate one area. The other thing that I do, especially when you've got these asymptomatic dogs, is to do the hair tissue mineral analysis testing, where we take the first sample, send it to the laboratory, and we actually get a different cellular level look at what's going on with the adrenal glands, the thyroid, and the pituitary. And it's trying to make sure, like sometimes the adrenal could be off, but maybe it's because the hypothalamus isn't sending the signal back to the adrenals telling them to shut down, to stop sending the signal to continue to produce, or maybe the pituitary is not connecting up right. So it's not just the adrenal glands that are involved. You have the hypothalamus, the pituitary, and the thyroid together. So looking at it from a larger perspective than just the adrenal gland itself, especially when you've got one that's asymptomatic. Also, in these early stages, a lot of times it's providing those other vitamins and minerals that the adrenal glands need in order to work properly. Makes a big difference. And that's what you're going to find out on that testing. Plus, sometimes there's toxic metals that have created a chronic inflammatory cascade that has then perpetuated and led into this. So those would be the things that I'd start looking at. There are a lot of different companies out there that have products that can help, like Standard Process has the adrenal, canine adrenal support. There's some companies, Prana, Prana, that has different liquid drops of herbs that are blends that work really well, looking at those other endocrine glands to help with the cushingoid dogs as well. So a couple other options there. And also correcting diet. I certainly wouldn't, at that point where they're making a lot of cortisol, I would work at looking at their metabolism. And a lot of times those dogs are not going to be doing really well if they're on a high carbohydrate diet. So trying to get the carbs out of there can help to stabilize some of that as well. And just another point on that, that Cushing's is certainly an inflammatory disease. And so it totally fits in with what we've been talking about too, because there is a degree of inflammation going on there. Okay, good. Next one. Okay, so we've got an adopted rescue had a large hot spot on his side. Okay, I'm guessing that means the side of his body, not the side of his cheek. Okay, and you did a turmeric coconut. It healed so quickly, I couldn't believe it. Oh, that's really good. Yeah, so the between the coconut oil and the turmeric being able to cut the inflammation that was happening there and to help dry that up. So thanks for sharing that. Others out there with those itchy, sore spots, especially oozy spots, being able to make that coconut turmeric mix. Thanks. I probably don't do that one enough. Oh, you're welcome. We're at the hump day. Wednesday's the hump day. We've got 3 days down and 1 day left to go. Tomorrow, we're going to be talking about managing pain that's caused by some common diseases. So we've got Katie Woodley, and there we're going to be looking at the ears, problems with the ears. Julie Ann is looking at some holistic pain support for cats. And then Dr. Barbara Royal, in her program, it's from a practice perspective, the different integrative pain therapeutic modalities, the underwater treadmill, some things like that. And then also Dr. Janet Gordon Palm, with her program, it's about post-surgery. If you don't want to do the drugs, which is commonly dispensed, the Medicam or the Remedil, things like that, being gabapentin, tramadol being dispensed post-surgery, is like looking at what are some other things that you can do and some successes that she's had with products post-surgically, as well as some of the drugs and talking about them, the ups and downs. So another day of some good mind expanding information and opportunities to just pull the whole spectrum about pain management together. All right, so other things that we could talk about in regards to inflammation and pain. And I always go back to doing we do have a way that you can monitor inflammation. We can actually get an inflammation number. How severe is the inflammation in that body? And that's by doing the hair tissue mineral analysis test. So it goes to the lab and we get these mineral levels, and sodium on this um, graph is not salt. It's not sodium chloride, it's just sodium. And sodium, elevation of sodium in the interstitial fluid is the response that the kidneys have to do to the adrenal glands producing aldosterone, which is the pro-inflammatory hormone. And the higher the sodium is, that's the greater degree of stress and inflammation that that individual is carrying or having to deal with. So the more or the longer that that sodium is elevated, the greater the likelihood that that individual is going to develop then one of the diseases, which we'll be talking about tomorrow, that are those of inflammation and pain. So diabetes is inflammatory, heart disease is inflammatory, any kind of itis, so dermatitis, colitis, gastritis, arthritis, any itis is an inflammatory condition. Cancer is inflammatory, obesity is inflammatory. So any of those situations that come on, we actually can know, is this individual headed that direction? How bad is it? And then we do the things to correctly bring that down. And with that, then by handling correctly, because we see the whole pattern, then the inflammation goes away and those pain problems are less and the body gets happier because it's not having to deal with all of that. So it's the way to get to the original why. Why did this develop? Why is this going on? And that's the purpose with doing the fur in the dogs and the cats, hair in people, but doing that tissue mineral analysis testing. It goes to a laboratory and then it's tested there and we get the report. It takes about 2 to 4 weeks to get those results depending on the backlog, because there's certain processing that has to happen with the samples that they receive too. A lot of different research coming out now on this. I mean, it just continues to grow and grow. So I think we've gotten over the hump of concerns about the validity of this testing, and now it's proving in more, it's like more doctors, more researchers looking at it from a bigger eye, a wider eye view, and running the tests on a lot of different reasons. I recently read the report. I've worked with Sarah Rosendahl, who's a veterinarian in Finland, and she has done some research and had it published about being able to use this to predict, monitor variables within dogs that have seizures. So a lot of things happening there. All right. Got anybody with a desire to get something answered? Or at least open up a dialogue of questions, of answers, questions about a topic that has anything to do with pain. I can say we haven't talked much about this, a little bit, but chlorophyll is one of the things that you can easily get over the counter. And you can access it in a lot of different forms. There's liquid, it can be in like capsules or pearls, but chlorophyll is very good with reducing guanidine, which guanidine is produced at the site of inflammation where there's a lot of heat. So you burn the roof of your mouth on that piece of pizza or that cup of hot chocolate. You said, I need to wait, but you just couldn't wait. Well, right there, I mean, initially it hurts because it was really hot and it burned, but it continues to hurt for hours or days because of the fact that in that heat process, guanidine was laid down. And guanidine maintains them as it continues on with this irritation and the hurt. And the chlorophyll breaks guanidine. So it helps in those areas where there's a burn like that, or if you burnt your hand on your curling iron, then you could put chlorophyll on it topically. It comes in topical. It's a very, very, very dark green, but it has that smell of a fresh mowed alfalfa field. But chlorophyll is also good in helping with detox. It helps at certain stages with the kidneys. It's very supportive there. It soothes the epithelial lining, any epithelial cells. So it's good for intestinal GI. If an individual's had a lot of, I would think like parvo puppies, where they slough that intestinal lining, chlorophyll is really good to soothe and help heal those cells. So that's another one, and it's a food item. So it's not always looked at from a medicinal perspective because not being another type of compound, but it's one of those items that you can have on your shelf. I have some in my kitchen for if I do burn something, but then being able to add it in those other ways to your food or just given to the animal. And it could be something that you do now and then when something arises. Doesn't necessarily mean they have to be on it all the time, except for some of those renal patients. It's a good thing to be on. Okay, posting links of recommended arnica, both oral and gel. So the arnica that I use is through Bioactive Nutritionals, and that company is in Florida. So those are that, and then I actually have gotten some arnica gel that was a organic arnica in a tube that we picked up at I think it was like a CVS or something like that when my sister was having some pain. And so there's different qualities of those that you can get. But if you can search the company and see how they were made. But so the oral drops that I use, the liquid, is through the Bioactive, and then the gel that I'd use that now Bioactive also has a burn spray, which I have on my site, and it has arnica in it and calendula and some other products that work really good as a spritzer. So you can use that as well and order that up. I have that in stock. And then Dr. D's program, I think, would have had some problems too. Some product recommendations on her site as well. Okay, so Patty says that you have a lot of problems getting your dog to eat her supplements. I end up wasting a lot of food and supplements. Oh, she doesn't like the chlorophyll. So is her me or is her somebody else? Uh, Due to the taste. I don't know. I think chlorophyll tastes really good, but it does taste like alfalfa. So if you don't like it in the gel, there is a liquid form, and maybe the chlorophyll directly, maybe that's too much. You could try aloe vera. There's also chlortabs, so you can get chlorella, which would be another option too, and they're really, really small tablets. So that may be another option for you to use that instead of like chlorophyll pearls or something that's just more concentrated. Okay, Mary Lou asks, what is the best essential oil or pill to reduce separation anxiety in a 16-year-old multi-poo with an enlarged heart? Okay, so that is a loaded question because not everything works well for everybody. But I would say because of a heart problem, because of 16 years old, that individual is low in calcium and magnesium to begin with. And nothing else is going to work as well if the calcium and magnesium is low. With a heart condition, they need both of those. So I would start with adding in calcium and magnesium. So if you found a standard process as CalMay Plus, that's the one I would go with. You can order it through my website at the shop preferred vendors. And then you just find the icon for standard process and log on. And they have one called CalMay Plus. And the plus in there is a parathyroid gland. So it's actual parathyroid. And reason I recommend that is because of her age. I'm sure the parathyroid gland is not working optimally anymore. So that's the one I would recommend. And for a multi-poo, calculating out her weight, guessing what they are, somewhere between 1/2 to 1 tablet twice a day. I probably would start with one twice a day. And then as things got better, you could back down. But definitely start with calcium and magnesium for whatever brand you use. That's where you got to start. Then beyond that, for separation anxiety, um, yeah, there's still not any one thing that works for everybody. You have to kind of do a little search. And one I found that works well is again Mediherb. They have a valerian complex. So something that has valerian and St. John's wort would be my go-to. The valerian is nature's Valium, St. John's wort. Those are both good calming aids, but they're only going to top it if you've got the calcium and magnesium in there first. So that's what I would do. I would do calcium, magnesium first, the CalMay Plus Optimal, and then something with valerian and St. John's wort that you could drop her, and that way that you can get it you can adjust the dose depending on, because she's so little, and find out which is the right one. You might also be able to use the diffuser at nighttime or when you're going to be gone, and use a diffuser that has either a calming, there's different ones. doTERRA certainly has a calm. They have several different ones that are already blended for that. So you could do something like that in a diffuser, which is not something else going through their body, but it goes in respiratory and then right away is up at the brain level. So that's the things I'd be thinking about. Okay, Pet has a 6-year-old Labrador recently developed 3 skin tags. Oh, skin tags are a liver thing. Ear, shoulder, and inner thigh, all on the left side. Oh, interesting. Okay. So I do know that when a lot of times left-sided backup has to do with kidneys as well. But those tags are a liver thing. How concerned should I be? I think it's an early indicator. As far as removing those tags, you can use a topical that has there's a lot of different topicals that you can do. Sometimes I've used concentrated iodine, depending on how thin they are, and they would just like dry up and shrivel and fall off. Sometimes you could paint something with some bloodroot. There's a lot of different products out there with that. You can do that and they'll dry up, and I mean, it will dissolve them as well. So you can eliminate them that way, but obviously, why did they get there? So I would be looking at some kind of liver support product. Standard Process has the canine hepatic support. There are a lot of different liver support products, whether you go with the Chinese, traditional Chinese medicine wise. If you like Ayurveda, Banyan Botanicals has a liver, what's it called? Liver complex or something like that. Any rate, if you go to the Banyan Botanicals, there's a tablet that's a liver one, and a lot of dogs test good with that. So that might be another option. There's lots of liver support, but that's what I'd be looking at there. Also, one thing with the liver is making sure that they're not on a high carbohydrate diet, because the liver has to break all the carbs down. So raw fed, that's good. So you probably already have eliminated that. Phytosynergy, good. MCT oil, omega-3. Okay. Yeah. So that's what I'd go to. And then again, if you want to find out more about how all of that's progressing, would be doing the hair fur tissue mineral analysis test. Does that really get you to the bottom line? Thank you for that one. All right. Waiting to see if we get some more coming in here. Hopefully everybody's enjoying the weather that they're having, and it's where I'm at, it's really, really nice right now. We're in that fall time of year. You're welcome, Pat. Oh, I see the picture there. All righty. Yeah, nice. Doesn't look overweight, very alert, tail's wagging. Yeah, very good. Good that you picked up on those skin tags too, because those would be a little thing that could easily be overlooked, but you're catching it early enough before other things develop, like lipomas and things like that. How does the HTMA test need to be done through my vet? If your Thank you, Kim. If your veterinarian is already familiar with doing the test, then they would have a system in a laboratory and collect the sample. If you're, I mean, I can, wherever you are in the world, you can email me and I can actually get you the directions to send it to me, and I can submit it for you and then do the interpretation. There's probably now about 3 companies, maybe 4 in the United States that are doing the testing, and they have different methods of producing the results. And the testing methods are similar, but there can be variables based on whether or not they wash the sample, which we don't want to wash the sample at the lab. You know, you can either bathe them 4 hours or more before you collect the fur, or you can do an alcohol wipe at home, and then it gets clipped and then sent and processed and all of that. So we're working on and on raising the awareness of this test and getting more veterinarians to do it. And there are more veterinarians around the world doing this testing. This past year, a veterinarian outside of Great Britain on the Isle of Man has started doing this testing. So it's happening all over the world. and it may be in your very own neighborhood. You just have to ask your vet if they do it, and if not, then you can reach out to me. Be happy to help. Or the other option there too is to encourage your veterinarian to actually learn about it and then start doing them in their clinic, because it will dramatically improve their nutrition program that they're offering. It can also help give some of their staff another avenue to excel in, for someone there to get good at it too, to help the doctor in their presentations to the client, with the results and what needs to be done and all of that. So it's a great revenue stream for the clinic. And then it helps you all because you know the right thing to do and it's not guessing. We want to take the guessing game out as much as we can. All righty. So who's next? Anybody got a question? Comment? I think we've found most of the ones that were on the website, on the yeah, support page. We've gotten those. I was trying to think of maybe a specific example of some animal to give you on things that I've done. I can say over the years, the alpha stem microcurrent therapy has been huge in my practice and helping with pain in all four pathways. That was in the program. We talked about that. I think the benefits of low level laser, being able to apply them at home, is greater than just getting it now and then when you go into the clinic, being able to do that. But of course, it takes up more of your time and you have to be able to have a willing animal. How Here we have a new question. Thank you. So Patty asks, how do we handle dental pain on a tiny budget? Well, so I guess it depends on whether or not the pain is what you would do, whether or not the pain is just like at the surface, or are we talking like a bad infection and bad root and that kind of thing? Or is this dental for a cat or is this dental for a dog? So is this a dog or a cat? And is it just at the surface or are we talking about a bad root? So or are you talking calculus and how to get rid of that? So if it's just on the surface, it varies depending on who we're talking about. So there are things that you can mix up at home. So you can get, like you could use some coconut oil and you could get some essential oils. So like even like a blend of an essential oil that's for like On Guard, which is for infection and things like that. So you would look at those and you could dilute out, like use a drop, depending on the size of the mouth, a drop or two to like 5 or 6 drops of the coconut oil. And then you could put that on a Q-tip and roll it around their mouth or put it on your brush and do the brushing. If they don't like the brushing and that motion, then you're down to using something like a little sponge on a applicator or a Q-tip. Okay, so Patty says she doesn't know how deep it goes. It's a dog. Okay, good. So I can talk dog wise. And then doesn't know how deep. How do we get rid of the calculus? Okay. So if there's just redness or you're wanting to clean, that would be one way there. How to get rid of the calculus. So topically, just taking, I mean, there are dental scalers that you can purchase for around maybe probably $20 now. They're like stainless steel, and you can, even if you just get one at a time, but you get them used to you getting in there with this, just looks like I don't know, like an ink pen, but it's very slender and it either has a flat curve at the end or like a crescent shape. And you can use those then to get that calculus off. The real underlying thing is that the phosphorus level in the interstitial fluid is higher than the calcium. So interestingly enough, adding calcium may be the solution to that. to make them quit putting on the calculus. But at any rate, you can use a hand scaler, which will save you from having to go and just do as many teeth as at a time or what you can get. You also, before you do that, if the dog is really gum sensitive, you can get some of that numbs it, like they use on little babies that are teething, and you can kind of put some of that along the area where you're going to be working. So if you've got 2 or 3 teeth that you're going to work on, apply that first and let that kind of set in, give it a few minutes, and then you can go to do your scaling. So there's those two options there to help. What I said before about the coconut oil and the essential oil. So that would make 1 bottle of essential oil last a pretty good time by diluting it out and doing it that way. The New Zealand Deer Velvet has that topical spray. There's that you can put on. I really like when you're working in the mouth and you've got a problem, I like to go directly to the mouth, not something that goes in the food that works its way through there, other than, the calcium phosphorus ratios needing to be good. Um, Other things that you can do in the mouth, you can make up the paste like everybody will get in the email. It has neem, and also you can use hydrogen peroxide diluted. Now, it's not going to be a big volume. They're not going to be swallowing it. So you don't have to worry about them upchucking. But like you would use hydrogen peroxide to get one to vomit if they ate something and you wanted them to get rid of it. So for people, they'll use peroxide diluted out and you rinse your mouth with it. And I do that regularly. So you can take the peroxide and then use that as well. You could make a baking soda mix and run it across there like they have baking soda and toothpaste. So there's a lot of different things you can do to help get that loosened up. And then sometimes then that adds to making it easier for you to use the scaler and work on them that way. But anything you do is going to be a benefit. And then if your dog likes chewing on the big bones, you can get the raw bones, and then that helps as well. There are a lot of dental things out there, but like chewies and that. But when you look at the ingredient list that's in them, a lot of them are not that good. And some dogs, it's a couple bites and then it's gone. So it doesn't, they're not necessarily working at it. But the raw bones really do help. So that's a benefit. That one definitely fit in with what we've been talking about. We had the dental program yesterday, and very enlightening. A lot of really good information in there. But as you can see, just from that dissertation that I did, there's a lot of different ways that you can, on a restricted budget, help. It's not like you shouldn't feel bad when you go in and the vet says, "Oh, you have to have this dental," and then they don't give you any options. There are other options out there, and so there are ways that you can help without breaking the bank. Because I've been amazed too at how expensive I've seen some invoices come through and how expensive dentals are compared to, what, 20 years ago when I was doing them. Actually, more than 20 years ago since I last done a dental in my own practice. So they were a lot less expensive back then than what they are now. It's a little bit of a sticker shock when I saw some of those. So I get it. All righty. I know we've covered between now today's day 3, we've covered a lot of different territory on different subjects about inflammation, some with the paws. We had the program today with ears, how to approach that, and getting those ears cleaned out good and treating those. We even talked about before yesterday or the day before, had some about ears. I think it was our first day. So there's a lot out there that you can do, and we've certainly had a lot come through. Okay, so Laura Leah says that her dog was injured. Um, okay, so there was an injury to the kneecap, ligaments, cruciate. Um, okay, to do everything was going to be $7,000. That's certainly a lot of money. Okay, so the best way to approach that. So we're looking at one knee for sure, potentially both knees. So things that I would recommend that can be helpful, the list would be, uh, one would be low-level laser at home or the alpha stem, whichever way you wanted to go with that. Number two would be, there are leg support wraps of different kinds. There's many out there. There's some that are hinged, some that are just like Velcro kind of things. So I would take a look. I would Google some of those up and look at. There are a variety of them. Now, they don't always work right when you're talking the stifles, the knees, because the dogs are wide at the top and then they get really slender. And a lot of times they don't want to stay in place, they slide down. So sometimes trying to do the bandage route, even just early on for support. I have had some dogs in the past where you did the support for a little while and then they got stronger and stronger and then didn't need it after a while. So, or only if they were going to go for a big walk or after they did the big walk. So the other thing here is going to depend on how big the dog is. I'm guessing probably not a large dog, but if the dog is overweight, you need to get the weight off. So that again is looking at, don't feed the kibble. If you can't afford the raw food, do some home cooking, canned food, something that to get the weight down, because I don't want them skin and bones, but just to not be overweight is going to help. And then the things that you want to look at, number one is going to be supporting those joints. So standard process as canine musculoskeletal support. They also, on a human product, they have one called Ligaplex 2. Then I would also add calcium and magnesium in there. So I have a company on the website, Endomet. You call them, there's a product they have called Paramin, which is calcium and magnesium in a tablet. I would add on something like that. You got to get those levels up so that this tissue can get strengthened. Then as far as pain control, well, that's what this whole program is about. And I bet that's why you're watching these and why you signed up, is because of what's happened to her. And so you've been learning over the days, all kinds of things. So you've got MSM, you've got Boswellia, and those can come in powders and tablets. You've got what Dee shared today with the homeopathics. Um, I don't need to reiterate all of them. So you've got lots of options now from that perspective, but I would add in those other items that I mentioned. And no matter which one it is, whether it's a ligament, a disc, a tendon, whatever, all of those are going to help. Also, depending on the age, an older individual, the glucosamine and chondroitin is going to help keep the viscosity in there and help that joint heal. And most joint products now, the canine musculoskeletal included, has those in there. So, but if you don't use that product and you're picking the calcium, the Paramin product, maybe the Ligaplex 2, and then you get something else that has glucosamine, chondroitin, MSM, and Boswellia. There are products out there that have all of those. Platinum Performance, which you can Google them through my site. They have a product called, oh shoot, now what is it? HA, Orthocon HA. And so that would be one that would have a combination of a lot of items that your dog would need. ORTHOCHON, and then HA stands for hyaluronic acid, at hyaluronin. So that would be a product that I'd also recommend. She's 17 pound. Okay, so I'm guessing that she's not obese, so that's good. The fact that she's small, that's also good. It's much harder when something like this happens on a 50 to 70 pound dog that's even not overweight, but just they're bigger, they're taller, the gravitational pull is much, much worse. So any things to start with? Well, I guess the quickest things to start with are going to be, while you're doing the research on the splints, the bandages, the devices, would be to get started on that joint support. So the Orthocon HA or the Paramin or the canine musculoskeletal support, the Ligaplex 2, all of those, plus the MSM, Boswellia, those kinds of things, arnica, depending on how recently it's been. You also can use gels that you massage in. There's the Blue Emu, which can work really good. That's a human product. You get it at, I don't know, Walmart, Walgreens. I don't know if they still carry it now, but you could Google that one up, Blue Emu. And then you rub that in. That's also a good one. And there's other topical liniments like that. Most of the time, dogs don't like the things that have the menthol in them. They're not real wild about that. But Blue Emu would be another product that you could get that you could massage in. So another way to help. That allowed me to use my rehab that I did for so many years and enjoy. All right. If a dog has two masses suspected to be cancer, is it okay to do the hands-on exercises? Uh-huh. Yeah, sure. Um, these are new masses and have scheduled an ultrasound. Vet wants to do an aspiration, but I prefer not to, concerned that aspiration could stir things up. Do you agree? I think you're okay with an aspiration. I mean, I'm not sure where these masses are. If you're scheduling an ultrasound, then I guess they're thinking they're inside the body. I mean, you could have a mass that's under a muscle or on the side. So I don't know where it is. If it's on the outside somewhere, I certainly don't have a problem with doing an aspirate. If it's inside, then I guess you can do the ultrasound and then they'll give you the options of what they believe it could be in the odds. But certainly to do the aspirate is the only way you're going to know for sure. But there's no contraindication with doing hands-on exercises. Yes, you wouldn't want to put laser over an area if you think there's cancer in there. The alpha stem you can put over an area, but you don't want to do laser over tumors. So that would limit some of the other things, but hands-on exercises are totally fine. Oh, it's a burner. Yeah. So, oh, hi, Debbie. Yeah, as long as you know, there's nothing that's uncomfortable about it, then no problem at all there. Thanks. All right, so we got about 10 more minutes before everybody scoots off until tomorrow. Tomorrow's our managing pain caused by common diseases. Looking at ears, going to do some pain for cats. We're going to be talking about integrative therapies. So when we talk tomorrow with Barbara Royal, there'll be more information about some of those other devices and things. And then Janet Gordon Palm talking about post-surgical pain and other options there and things that she's utilized that she feels are very significant and helpful. And it's nice to be able to put together everybody's focus and then decide which ones work just right for you or right for your dog or for your cat, because not everything works the same in every body. And that's why it's so wonderful that we have this holistic approach and all of these options that you can choose, including acupuncture. You're welcome, Debbie. Acupuncture is another tool. We didn't really have, I don't think, anybody talking about that this go round, but it's been around a long time. I've utilized it myself and is one of those other tools that is good to put in a lot of different scenarios. You can always add it in. You're not going to see the instantaneous results like you do with chiropractic, but it's a good one that's generally safe. Sometimes limitations in situations where there's cancer, but other than that, um, pretty safe for most other conditions. All right, deer and elk antler velvet. So yes, that is a good product. I use the New Zealand deer velvet. I've gone blurry and I'm not sure. I'm not on my screen down here, but it is coming up that way on the something with the internet, I guess. Oh, there we go. So I use the New Zealand deer velvet, and they have a joint, the cat joint one. Man alive, cats just love it. They eat it up, and I've not had people return it because the cat wouldn't eat it, and they get running around and jumping like they're young again. So the cat one goes over really good. There's a dog joint one that's been very successful. There's one that's for like a, for it's one called Hemo. It's for cancer patients too. And then Pentagenesis for allergic situations. And then they have the oral spray. So that's the company I've been utilizing. They've been out a long time and I started with them. They're out of New Zealand. And so I just haven't changed to somebody locally because Barry's so good with the product and I work closely with him to be able to distribute it here to others in the United States. So you can go to my website and purchase it through there and learn about the products too via their website. And there are some other companies in the US that do it now as well too, and I'm sure probably in other places. But the good thing about it is that nobody died for the product. The deer and the elk, they're going to shed that skin anyway. Now it is harvested a little earlier. It's not like taking the whole cycle as when it falls off and then they like pick it up off the ground or something. That's not how it works. But it's something that they replace every year. So no animal is being traumatized, they're not dying in order for those products to become available. So that's kind of a good thing, but I've seen them work very, very well. All right, supplement recommendations for senior cat with diabetes, neuropathy in the feet and legs. Okay, so diabetes, it's always going to lead to that neuropathy in the feet and the legs, like it does with people. They'll get that low gait. First off, when you're handling a diabetic patient is the liver. So definitely diet, liver support. So there's a feline hepatic support tablet from Standard Process that works really, really well. All diabetics are magnesium deficient. So depending on the age of the cat, I probably would go with I'm guessing older because diabetic. So probably 12 or more. And so I do the Standard Process's human product called CalMe Plus. It has calcium and magnesium and also has the parathyroid to help there. And so on a cat, somewhere between a fourth to a half a tablet twice a day. And maybe in a big cat, if it's a cat that's like 14 to 16 pounds and the neuropathy is really bad, then I would bump that up to maybe one twice a day for a while until you start seeing improvements. And then you could probably back down to a half of one twice a day. So magnesium, got to get that on board. You want to balance that with the right calcium and keep it in solution. So CalMe Plus, the hepatic support for sure. People tend to think diabetes, it's just the pancreas, but there's a big liver factor in that. And then the neuropathy in the feet and legs. So things that you could do, you can do massages. You could do some tactile stimulation. You certainly can do laser. So the cat could lay on the laser. You could do beamer, which isn't inexpensive. It's very expensive, but a lot of cats like laying on that, and that'll help with neuropathy. The low-level laser definitely can help with that. Trying to think of other things that what you want to do is improve the circulation. So, like I said, even massages there can help. I'd be looking at things like that, stimulus, tactile, even if it's an older cat having, again, in the wintertime, some kind of a warm place that they go, not just warm like, oh, it's by a door, the sunlight comes in, but I'm talking like a heating pad or heating blanket or something like that that's got a little more thermal, especially with the diabetes. A lot of times they've gotten skinny already and you're working at trying to maintain their weight. The other thing too is a lot of times with the diabetes, you get the hyperthyroidism, and thyroid needs a lot of calcium in order for it to stay in the right level of where it should be working. So another reason for the CalMe Plus. Okay. Oh, there's a cute kitty. Paul asks, will anything be done on inflammatory bowel disease for cats? Okay, his veterinarian thinks that the cat has partial paralysis of his intestines. Oh, okay. On Miralax to help him. Okay. You've tried all sorts of homeopathics, but he doesn't respond to anything and he hates coconut oil. Okay. So, so inflammatory bowel disease, and you talk about the paralysis. Does that mean he's constipated and that's why you've got the paralysis? All right. So to help move the bowel, so massaging the bowel is one thing. So you can do abdominal massages on the cat. Diet, I'm sure you've been through that. So getting the cat off of any kind of a kibble, high grain diet onto a carnivorous, oh, he's constipated, carnivorous diet. Did you see Dr. D's program? She actually has, go back to the original one there for me, Gendy. You said you've tried all sorts of homeopathic stuff. Okay. So you probably already tried Dee's product combo that she has for constipation. So I know she talked about that some today. Um, okay. Um, all right. Back to that constipation thing is, the massaging, sometimes putting laser over that area, the low level laser that you would have at home can help stimulate that. The other thing is chiropractic adjustments. So you can have subluxations in the spine that then the nerves aren't going well to the intestines. And so sometimes chiropractic adjustments can help those cats with the constipation problem. So chiropractic, um, bowel massaging, another thing you could look at is, oh shoot, that real old one. I just talked about it yesterday. Uh, uh, um, oh, I hate that when that happens. Cuddle, no, not cuddle roll. What is that? Uh, I can't think. Not on kibble. Okay, well that's really good. You're helping there already. Um, Uh, we talked about using it on an external wound. Castor oil. Sometimes there's some castor oil things that you can do. So I would check on that and see that might help too. MediHerb has a tablet called Colax, Colax. I've had it work really well in some cats. A couple years ago, we used it in a cat with the constipation, and it did not make a difference at all for that cat. So that would be something that else you could try. It's a tablet. It may or may not help, but yeah, there's some other things. And then I go back to doing the hair tissue mineral analysis testing, find out what mineral levels are skewed, and if there's any toxic metals, maybe there's aluminum or mercury or lead or something in the body that's adding to this problem. But definitely want to get the nerves stimulated. So the chiropractic, the laser, the massages, and all that. And if those are things you haven't tried, then that'd be some other things you could try. All right, so we've got time for one more question. We're down to about 3 minutes. Is laser okay as long as it's not done directly on the mass and only along the spine and hips? It's on his sides. Yeah, that's okay. Right. So the idea is correct, Debbie, that it's okay in the body, just not over the area of where the masses are, especially if we're talking cancer. So you don't want to put it directly over because you don't want to stir anything up. But it's certainly okay to use like post chiropractic or something like that, as long as the masses aren't below where the laser's being applied. All right. Oh, thanks, Paul. I hope that works. Let me know if any of those help, because this problem with constipation in cats, it's a very frustrating thing. And the more data we get on what's helped who, then it helps us to be able to pass it around and share it with others. So I hope some of those work for your kitties. Really cute. All right. Well, thank you, Kim, for being a part. Oh, you're a horse person. I like that too. Yeah. I do try to be informative. And it's all coming from, what everybody's perspective in life has been. So grew up rural and, yeah, so it gave me some insight to some things that I probably wouldn't had the opportunity for had I lived somewhere else. All right. Well, thanks, Paul, for your enthusiasm there. And I do hope some of those help because that's a sad thing. You're very welcome, Mary Lou. Hopefully, I'll see you guys tomorrow. So, same time wherever you are, and same place. We're all in our homes or offices or wherever. But any rate, we'll be looking forward to reconnecting. And until then, give all your critters a kiss on the noggin from Dr. Ava, and we'll see you tomorrow.